I know plenty of doctors around the country that, number one, he's busy as anything. It's not like he's here because he needs to work. I'll tell you right now. Anyone working with Daniel is lucky to have him, period, the end. And that's the facts, period. That's real. I know plenty of doctors who he's particular about who he works with. And I can share this with you. I know for a fact, I know that he delivers for people. This isn't like many or most marketing agencies, which they throw a bunch of crap on the wall and expect hope for it, some of it to stick. No, that's not where we're at here. This man will deliver consistently. I personally know doctors that he's delivering on big numbers, okay? This is the real thing. You're fortunate to have, if you ever get a chance to work together here with us, he knows what's up. And not only that, he knows the cost of our equipment as well. He knows that as well. Because a lot of the doctors he works with has our equipment. So I'll let him speak for himself.
Let me just give you a little brief. Digital marketing agency that primarily specializes in paid advertising and helping service-based businesses scale using paid advertising. We mostly focus on chiropractors with red light, med spas who have like cool sculpting, Venus Legacy, and just an array of products in general in the health and wellness space. And over the last 2, 3 years, we built a system that is essentially an acquisition system that allows service-based clients like yours to be able to bring in clients at a profitable rate. Because I know we all know that a lot of times we have hired a Facebook ads agency and we throw a little bit of money at it, we get some success, but there's a lot of flaws in the system as to, for example, leads who suck that just don't respond, or people who come in but it costs way too much, or just a system in general that isn't scalable. So what we did was we created an acquisition system that handles the first touch point, which would be an ad, all the way down to the second they come in through the door. Our agency handles the entire aspect of that process. So given that and given the amount of money we spent on this system, we've been able to help dozens of chiropractors and just medical professionals in general scale their red light business, their med spa business to multiple seven figures using the system. And right now we're growing at a pretty fast rate. So yeah, that's the little brief about us. How about you? Can I hear a little bit about your business, what you guys do?
Just so we're clear, John is the consultant. He's got a hard break at 4. George is the doctor, and he has more leeway.
So
Yeah.
I'm an osteopathic physician that specializes in osteopathic treatment to help to help people relieve pain.
Nice.
And that's really the main focus of my practice. And
how do you help individuals? Do you use cold laser in the chambers?
Mainly my hands. Now,
okay.
Yeah, once in a while I'll use infrared as an assistance to my treatments, but I wouldn't say that's anywhere near the main modality. I would say the main treatment is the manipulative treatments that I do.
Oh, nice.
Said that. I originally met George because he was giving a lecture at a biohacking conference. He was the doctor speaking about red light therapy. They employed him.
Oh, there you go.
He's very, very, very well versed in this stuff.
Right.
Just curious, how's it like scaling that business? Since are you the only one who handles the fulfillment of that service?
Correct. Right now I'm a sole practitioner. I have John as my consultant, and he's been helping me out for over a year now, and my branding, marketing, and anything related to that. But yeah, it's been just that. It's been very simple and organic, and right now we're really focused on SEO.
Okay, how's that working out for you right now in terms of just client flow?
Great.
Yeah.
Yeah.
Are you looking for more business? What would you say is something that is insufficient in your marketing or just branding as a whole?
Well, I mean, I think anyone who has a business is always looking for more business, but
of course,
I would say yes to that. What was the second question?
Well, if the marketing and branding's on par with your expectations, everything's going well, is it difficult to get new clients in through the door? Because I could imagine being a sole practitioner, it's hard to scale.
Well, I would say, yes, it's harder to scale also because I don't take insurance.
Okay.
So that's one of the obstacles. Otherwise there'd be a big line out the door. Like that's it. The issue is more of how do I scale with being a sole practitioner and really developing things at this point from my hands to the patient type of practice. And at some point I could hire people and scale it up. But right now obviously we're looking for more people who would be better
Right.
able to number one, want my services, who may not be aware of it, and two, afford it.
Is it easy to bring in clients with SEO? Because SEO is notorious for having a good flow. However, it's not scalable because you can't control how many people go to Google and search for your service per month. How is that like?
Well, I would say that's a good point. I would say it's a bit more organic. We do use some paid advertising for that, but I don't think it's tremendous.
How's the paid ads doing? That's my forte, so I'm gonna go and dissect
I
that one.
can't. You know what? I don't have the numbers, on the top
Okay.
of my head, so I can't really. I don't want to give you an inaccurate picture. But all I could say is I am noticing that people are finding me through Google. So
Okay. Perfect.
either between the SEO and paid advertising, it is working, and also word of mouth. So
That's a huge good sign because that means your service is good and your customer service is good. Because if you're doing good organic, that kind of sets you up for success in paid ads. Because if you're not doing good organically, paid ads will just excel the bad things that you're getting on organic. But that's good that you're doing that. And I was just curious as to how your paid ads are doing in terms of acquisition. Like I'm a really big numbers guy in marketing. That's why we're able to succeed in the way we do. So I'm
I
all about,
can't
hey,
give
what's
you
your
that
cost per?
number just because I don't know it. I can't, I would
Right.
have to talk to my consultant
Right.
who's doing that, the SEO people about it.
Yeah,
But I can
absolutely.
share with you what Daniel is that Dr. George is certainly understands the value of quality. It's all about the patient. He understands the quality of what the patients can really benefit from these kinds of technologies. It just has to make sense to him financially. The numbers have to make sense, which
Well,
is
of course, that's what I mean as well, because our system is very turnkey. Like if you tell me, hey, you want clients through the door in a few days and you have our system, it's already done. That's why I'm trying to understand the business to see if that would even be a good fit. Because say you're a solo practitioner and let's say you're capped at 8 to 10 people per day. If you want to scale, you either have to raise your price or get someone else to help you, right? There's only two methods you can do. There can't be
Correct.
4 Georges at the same time. So I'm curious, like, hey, how much are you charging? Since you're not taking insurance, is it a bottleneck to charge the prices you do and get someone to pay you? Because then that's more of a branding and marketing issue. Or are you able to charge the premium that you are, but you're just so booked out that you need help? So I'm trying to understand which avenue you're trying to go.
John probably be better to
Yeah.
answer that.
I mean, the first thing we did, and George is not inexpensive. And the first thing we did when we got together, I said, just raise your rate a bit. No one's going to leave you for a small raise, but you're going to put a bunch of money in your pocket by the end of the year. So that was the first thing right away. We have played with different pricing models and tried to work on what is the, where is the line in terms of what you can and can't charge. And the answer is exactly what you said. The line is how much you brand yourself.
Yeah.
And because you raise the rate based on your branding. And so the first thing we did was we renamed George's practice from New York Osteopathic Medicine, and we created a category called 360 Osteo, 360 degrees of osteo, which allows us to offer up lots of different services all under the osteopath heading and still maintain the really the authenticity, the properness of George's practice. George is a rarity because he's brilliant at what he does. There's hardly any people who do it like him. And there are hardly any osteopaths who still practice manipulative work, and it really makes a difference. So part of the conversation we've had in this, Daniel, may be further down the road, a little bit further down the road. George has a vision for a business he wants to create. And it's focused on a very underserved area of patients that could be as much as, you know, conservatively, very conservatively, 15% of all women, which is a massive number. And
That is a very massive number.
and
Which is
not
not likely. It's probably a lot
yeah,
more.
and not conservatively as much as 40% of all women. And people don't know they have these problems, but they just suffer. And so we've identified a category that the real issue is, how do you treat them? And part of what you do is you absolutely have to do what George does, which is the hands-on manipulation in this area, because it's a physical problem. It's a structural problem. And osteopathy does a fabulous job of structural problems if you're good at it. But there's an art and a science. The science they all get when they go through school, and they get their degree, and it says they've got the science. But the art is being able to look at a human body, touch a human body, and say, if I move this and I move this and I move this, it's going to make a difference. And that's the reason he has all those 5-star reviews. People rave about their experience with George. And so now the issue from business development is, what else can you add to the service, including light therapy, which is something George has been interested in for a long time. And who else can we bring in to help? So we're looking at other people who can support it. Physiotherapists, massage therapists. They have to be trained, but you can build a whole business around one doctor who offers all these secondary services. We're not there yet. We're just starting now to really ramp all that up, figure out what because George is the clinical lead on this. So he's the one who says, this is what we really need. And he doesn't follow the leader. He's not one of these people who just says, everyone else is doing it, I'm going to. It's a very specific way of looking at patients, of treating them and wanting to. And this therapy is one of the ones that he's looking at. And because he believes it can help make a difference. And the issue is, structurally, how do you build it into his practice where it is now and where he intends it to go? I don't know if that's too much information, but that's kind of where the thinking is.
No, more to your point, I have a client on Long Island who has been with me for a few years. He's a chiropractor who had a weight loss business. He was making around $250,000 a year. The issue, he was kind of like George, extremely passionate about what he does, and he had an awesome product. So he had a bunch of 5-star reviews. He was packed, but he couldn't scale. That was the issue, right? Because when you're doing the fulfillment, you can only raise your price so much, or the market's going to look at you and say, hey, I'm not paying X amount for this, right? Unless you build enough value to your program and you kind of you diversify what you do, like with what you said with the infrared lasers and whatnot, to where you scale. So we took him from $250,000 to over 7 figures with the marketing and just expanding the program. So you're on the right shoes because you have a product that works. We already know this. So that's already taken care of, which is step one. Right now, two is, what business model are you going to go with? Are you going to go hire more people? Or are you going to raise your price and you're just happy with you being packed with however many people you want to see per day? So it really depends. But if you need people to come in, you need more of an audience to come in, and you already have a good product, well, that's where the marketing will happen. But if you just want to raise your price, then you need to focus on branding. So yeah, it's a kind of a difficult corner to be in, because you kind of have to decide as a business owner, like, are you trying to scale and which way you want to go? However, us, again, we're very, very experienced with not only bringing in people, but bringing in people that will actually pay what you're charging, done through branding, right? So assuming that you have a good brand, which I do, because your organic is right, and like John said, he raised the price in the past and people are receptive towards the price increase. That is awesome. So as long as you have a good marketing partner who goes and helps you bring in clients that understand the value, and you articulate yourself in such a way to where they understand why you're charging what you charge, the sky's the limit for you, essentially.
Daniel, please speak about like ROI, basically just on fundamental terms, in terms of you're able to.
In terms of, again, like, I'm a really big numbers guy. So you as a business owner need to understand your numbers. We are very oriented with return on investment. Arguably, that's probably the only metric you need to care about when you're doing paid ads. It's like, hey, if I spend $5,000 this month, what is my return on that? Right? I mean, if you don't know what your return is, which ironically a lot of people don't, how would you justify an increase in price, or how would you even scale to more revenue if you don't know what your
Can I
return
ask
is?
you,
So
if I may
yeah,
ask on that,
of course.
what time frame would you be considering? So if we do paid ads, within what time frame would you want to look at your ROI?
We look at it weekly to make sure that our monthly targets are aligned. So say we're looking for a 3.4x ROAS, return on ad spend for the month. We make sure that our weekly targets are going to lead us to that monthly. The thing that we do again is we prioritize increasing your ROAS, return on ad spend, because you're doing paid ads. That's where the return comes from, right? So everything is tracked for us. Every channel we do, if we do Facebook or Instagram, we know how much we're putting in. We know how much we're getting out. We take it to science. We know specifically which ad is generating most of the revenue. So again, we need to know where to allocate the budget. It's not like you're just giving us a few $1,000 and we're just throwing it at the wall and telling Zuckerberg, go spend it. Like, we need to know which ads are working. We need to go and call you when we have our weekly meetings and say, hey, George, ad C is doing really well. Can you get us another version of this? Or, hey, the testimonial ads are doing really well. We're going to go and replicate this in different iterations. So without numbers, I don't understand how marketing agencies justify the allocation of money. To me, it makes no sense. And I'm telling you, a lot of people have no idea where their money's going. So again, from a broad spectrum per channel, it's easy, right? Like if you're diversifying your ad spend and you're spending 1,000 on Google, 1,000 on Facebook, 1,000 on Instagram, it's easy to know which channel is working. But the science is within the channel, what our customer avatar is working. If you want to scale, and we're already scaled one avatar, we need to go and diversify to a whole another avatar. Like which portion are we'll have no idea where to spend if we don't know where the numbers are. So yeah, we're big on ROI. We optimize that per month. Like this is a number we're very transparent about, and the sheets shared with you on a weekly basis what your ROAS is. And every month, again, we strive to just increase that number, not only with just spending more money, but with making sure that our cost per acquisition is the lowest possible number it can be through very rigorous testing.
Yeah, and as George said, we're hardly spending anything on ad spend. Hardly anything. It's nearly all organic. And we started out with some ad spend and we got results. And then the organic business just kept growing. So and the issue, Daniel, as you know, is there's one George. And
Right.
by the way, 10 patients a day, 5 days a week, not going to happen. And because he just wouldn't survive physically if he had to treat, because it's very intense work he does. And I mean, and I know, Michael, you understand that too, having been in chiropractic. It's physically, it's a demanding type of work.
I can't even imagine.
So the growth part is going to come from building out the vision. And by the way, that's the place where everything you're talking about will kick in, where you'll be doing different kinds of ads, you'll be testing them. And once you've got a way to service the patient, the issue right now is that so let's go back to the bed, the light bed. If we end up using that as a product for George, we have to have someone who services it. That's where you're going to end up doing exactly what you're talking about. Ad spend, driving patients, because you don't need someone to be standing over them, working on their shoulder, working on their, realigning their bones in their body. You can just put them on the bed. You can set it at a certain setting. And, a trained person stays with it. And then, yes, you're starting to kick up all that income. So that we understand, and we understand how that can work. The balancing act is, as an osteopath, which is a medical doctor with extra training in osteopathy. That's what an osteopath is. The thing there is making sure that we have every little bit of science buttoned down as we present this, and George has it buttoned down, which is good, so that it doesn't look like, and I hate to say this, and it's no disrespect, Michael, it doesn't look like chiropractors who are trying to make money. This is a, medical doctor who's been a professor and who is the top of his field. We want the science to speak. So the actual mechanics of doing this, where he's got time in Manhattan and time in Long Island, that's the other thing we're weighing. So our conundrum is that there's only one George. And we're working on building out a business that says there's going to be more than one, but it is aimed at a vision to help all these mostly women just in this area alone. I don't know how many there must be. If I just do the percentages, just do 20% of all the women within 70 miles of Manhattan, and you can see how big the business is.
Right.
But part of it is, unfortunately, that George has to lay hands on them. I mean, yeah.
Let me ask you, because with one of my clients as well, who was in your shoes, we just created, for example, his average order value, his average ticket when we first started making $250,000 a year around was like 15 to 2,000. And again, this was weight loss. All we did was create a package that cost 5 to 6,000 and justified it by solving more pain points, right? So I'm sure George is really good at solving what he solves. Is there a way that he can offer more and charge more so that they can justify it? Like, for example, not only with lasers, is there other things he can add? Because if you don't do that, the only other way you're going to scale is by having a training protocol and just bringing in more people to your team, right?
Well, that's why we're talking about adding, like, this is a combination program. It's a blueprint
Mhm.
of both
Okay.
also
We're-
electromagnetic as well as oxygen therapy, whether it be hyperbaric or exercise with oxygen therapy, which we use on the vibration platform, which is very, very
Understood.
effective.
Well, my goal in the near to, I would say the near to not so far future is to have a multidisciplinary
Got
practice, which with multiple services. It may include infrared, may include exercise with oxygen therapy. It may include a family doctor. It may include, really the concept is the 360 osteo approach, with the fundamental basis of osteopathic philosophy behind it. Because
Allowing the body to heal itself,
correct.
period.
And looking at everything
Exactly what
in
we're doing
dynamic
here.
fashion as opposed to a cookie cutter fashion.
Absolutely.
So it's been done before, but it's probably been at least 50 to 70 years since somebody's ever has done this in a multidisciplinary way. Last time probably is in the 40s or 50s. So I'm not reinventing the wheel, but it's going to be huge. But the concept has to remain the same. And how do you keep the concept and the philosophy, which is why people are coming to see the office in the first place, without without mass marketing? And organic seems to be the best approach as of now. Finding people I could train, that's
a whole nother science.
That's a whole
Yeah.
I got that down. Training isn't not an issue. It's just getting somebody in the door. So that's an issue of probably resources that John and we need to figure out.
Yeah.
But
Oh, so you have the people trained right now. The issue is you're not able to get them through the door
no,
at
I
enough
don't have the
volume.
people trained. The issue is
Okay.
finding somebody who's willing to get trained, and
Got it.
and two is perhaps paying them up front. People, they need a financial incentive to get in the door. In terms
Right.
of working with me.
Daniel, here's the problem for osteopathy, and it's a sad thing for the whole country. It's an incredible system. 90% of people who graduate in osteopathy, because they are medical doctors when they graduate. You can go practice medicine the day after you graduate. They go into orthopedic surgery or family practice in that order. And the reason, and then they specialize for 2 years or 3 years, like the surgeons, and they make tons more money. and they, because of the cost now of medical school has gotten so high, paying off those bills is the driving force. And
Of
so
course.
you see a lot of orthopedic surgeons who came out of osteopathy, and you see increasing numbers of family practice doctors coming out of osteopathy. As a result, the pool of people who actually want to do what Georgia does is smaller. If they were all just, if none of them went into these other fields, you'd find someone. There'd be
Daniel,
people.
I'm the last
Right.
one of this generation
Yeah.
that could provide this care at this high level.
It-
Most
Right.
people will do this in
It's
conjunction with injections and other PRP and just try to make money that way.
it's unfortunate as well because they have a skill set that's so different from other people.
Yeah.
However, if they want to take on less risk, they have to go where the money is. If not, they
Yeah.
run the risk of, like at one point you can't blame them because you understand, but then again, there's a field that's just dying and it
Well, nobody's
ripples
blaming
down
anybody
to
here. It's
no, of course.
it's the situation, and everything's run by financial
Right.
incentives, especially when you're
I know.
$300,000 or $400,000 in school debt at a 6% interest rate or more.
Jesus.
So they're financially, it's a huge burden for them, so they want to make the quick cash, and have somewhat of a lifestyle of what a doctor they think should have. So what we're trying to do is change that paradigm, and it starts off by not taking insurance. It starts off by providing high quality care.
Right.
And once we already proved that concept, now the next step is, how do we scale from there? Scaling will require us to hire more physicians and or therapists and or technology services such as infrared light. And two is then from there it's just it's just scaling will happen either organically or inorganic. I mean, that's not going to be an issue. So that's where the conundrum lies, is
Okay,
at this stage of the game, where do we get the financial resources? And I think that's the biggest hurdle, at least the biggest issue of the hour right now.
Let me ask you, if you don't mind, what's the average order for you? Like someone comes in, I want to see George. Like, what's the average ticket?
Sure, I could share my costs. So it's $365 a visit.
Okay, and how many visits do people usually get?
There is no usual amount.
Or-
Depends on their
All right.
situation. But some people come in once, some people come in every week. But those are few, and
So let me ask
Do you
you.
have packages?
I don't do packages.
Okay, so I would come see you. You'd recommend how many sessions I should get with you, and that session is priced at $360 per session.
$365 per session. Yeah. So
360.
right now I don't do packages because I want to make sure the treatments are tailored to that patient. I don't want to make bundling it up like a series of 4 or 5 may or may not be there. I've thought about potentially about maybe a membership model or something like that, but it's
Is once someone comes in for the recommended sessions, let's say I come in and you recommend 5 sessions and I'm completed, do you have some kind of recurring revenue model at all? Like maintenance or anything along those lines?
so I wouldn't call it a model, but I do make recommendations that if you
Got it.
would like to come in for maintenance, depending on your situation, you could come in quarterly. By everybody's so different with their underlying needs.
Right. I can't imagine.
But I define maintenance as once we get out of the woods with your acute issue, then it's about maintaining it.
Right.
Or if that makes sense.
Yeah, of course. Would you say a lot of people still stay with you to maintain the service once you treated their acute issue?
In terms of continuing with maintenance,
Right.
or
I'm just curious, like I was trying to assess the revenue that you have per person coming in per head over a 12-month period, right? To see if you have a recurring
Um,
revenue model, or because that'll dictate that for you to scale, you need to see a lot of people. The volume needs to come in. Or if you have a recurring revenue model, as in like the maintenance, then you don't necessarily need as much volume as you would, because they're going to keep coming back to you. So you're building revenue in the back end, and then
I see
that
what you're
once
saying.
scaled.
I would say that we do need I would say it's almost like a 50-50, a coin flip, because every person's so unique. Some people would want to maintain it every 3 or 4 months. Some people, you know, depending on their age, if you have a 32-year-old male that comes in with back pain and I fix it at one visit, hey, you know what? I'm good. I'll call you when I need you.
For sure.
So that's okay. And there's some people with underlying conditions that do require recurring treatments.
And just curious, what price did you start at? And in what increments did you raise it to 365? Because I know John mentioned that he increased gradually, right? Testing different
No,
price points.
he'd already been raising it when I came
Oh,
along.
okay.
I just added the last
I
little bit.
originally started at 250, and then
Oh, nice bump.
then I looked at what my peers were doing in Manhattan, and I was like, I think I'm undercharging, and I'm still.
I was gonna say, I feel like you're still possibly
I'm still definitely
undercharging a
not
bit, right?
at
He is.
equivalent to what other, you know, from hearsay. I can't really say anybody's told me for legal reasons.
He's undercharging, and once we unleash the story on the world of all these millions and millions of mostly women, but not all women. It's also, so there's men. Once people become aware of this and they realize that there's something that can be done to help them, the floodgates are going to be open. You can charge whatever you want. That's going to be part of the issue. You're not going to be able to meet the demand. And so what we want to do is build out a model, and we're testing it. We're pressure testing it one step at a time, because this is medicine. This is clinical. This isn't, this is serious stuff. And these people have serious problems. Once we know that, okay, this is all working, we've got it figured out, and here's how we can offer up ancillary services, and George just mentioned a few of them there when he was talking, then we can say, okay, we can raise the price. We could rate, let's say, imagine we raise the price to $1,000 a visit, which is what some people in New York do charge, who are hyper specialized. It still only scales to a certain point, and the demand is going to be so high. So we're looking into what are some of the other support things that we can do to help people to deal with this issue, which is underdiagnosed, but unbelievably underdiagnosed. Is that a fair statement, George?
I would say it's underdiagnosed, and the other issue, it's a naive population. Not most people know about chiropractors. Nobody knows about osteopaths.
Yeah.
The other thing is the population that we're trying to target, they may not know that they have an issue, but they suffer from it.
Yeah. Now, guys, I got,
to be honest,
5 minutes.
Yeah, got it.
I had lots of time earlier.
I apologize, the meeting. I had it penciled in for 3:30, but more to the point, I think that if you had proper branding now, aside from making sure that your process is correct, I think you can charge more, just because I have doctors on Long Island who I'm promoting weight loss, which is essentially like a commodity fix at this point. You're like hyper specialized in that regard, and I'm getting more per visit than sitting with you, and you're a hyper specialist treating even more in-depth problem, which should always yield to more money, right? The bigger the problem you solve, the more money you get. So I'm curious to take a look at your branding right now and see why you're not charging more. Have you tried charging more and it just didn't work well, or have you just stopped kind of here?
No, we haven't tried charging more.
Okay.
Because we haven't stepped
I
out
think
into the highly specialized world where you can, because the demand is going to be there. Right now, proof of concept is what George has been working on. And
that's tough, right?
Because it's clinical,
organic, especially.
Every time he sees a patient, he's able to work with them and see what works and what doesn't work. Because there's hardly anybody, there are physiotherapists working in this space, and they're doing exactly what you're talking about, Daniel. They are working with paid advertising. They've got like
I
websites.
work there. A lot of them are my clients, so I
Yeah, so you
understand.
know,
Trust me.
okay.
George is the kind of someone
He's
I haven't spoken to yet, which is ironic because I'm like, I'm getting more money for these guys, and George is the
yeah, yeah,
actual guy you want to see. So
yeah,
that's why I'm like, hey, why isn't George
They're
charging more?
definitely
This
getting the
seems
best value for their buck when they see me.
yeah, yeah, and so that's, but George isn't willing to go that way because he knows that actually it doesn't produce long-lasting results. It doesn't do what it needs to do. That eventually the people leave, and then but you just keep bringing more in because you're marketing, doing direct marketing. There are people around the country who've got like clinics and stuff set up. So once George gets to, and he's very close to it now, that clinically he's happy with the fact that he can provide exactly what these people need, then we're getting to the next step. And there are products that we have been talking about and George is working on them clinically right now to see that he can sell certain products. And this is where it really comes in. You make the videos, you do the whole thing. There are certain products
right.
he believes will really help people who have this problem. And as a result, and he's working right now with a set of inexpensive but very powerful exercises that he has to develop clinically that
Right.
will work. And then you go crazy because, yeah, then you sell 1 million of them. Then you do the video,
And
then you do the whole thing. You do the Instagram, the Facebook, you have the face for it. Someone's, the whole bit.
and let me ask you, so while George is prioritizing making sure the product is one of a kind, which arguably it kind of already is, why
Yeah.
in the meantime haven't you ran paid ads to attract the crowd that will just pay you double for what you offer because you're already so much more superior than 99.9% of the market?
Because he's got to identify who those people are. It's a very broad category, and it's got a subcategory. And if unfortunately, I'm going to have to go in a minute because
Yeah, absolutely.
this call is they don't like me to be late, and it's a very broad category. And there's a subset of it of people who really, really, really suffer. They go 20 to 30 years from onset of symptoms to diagnosis. During that time, people kill themselves. The pain is so terrible, everything's so terrible. The people in that, they don't have, a lot of them don't have a lot of money. And as much as you might want to, oh, just a sec. I'm hoping they've just delayed my perfect. And they delayed. Okay, my 4 o'clock. That's good. Let me know. Okay. So I do have a few more minutes. They don't have money, and there are those who do. And George sees some patients who, Manhattan people with a lot of money who have. In one case, I think he had a child. How often were you seeing that child, George? Every day, every couple of days?
No, every week, every week.
Every week, yeah, every week. Just to relieve symptoms. And yes, there are people like that. What we don't have yet in place, and we're just developing, and we're getting there on it, is the thought leadership, clinical documentation that we believe we need, not like medical journal stuff, just the articles and pieces that we need to say, this is what this is about, and then using that as the link from all the stuff we put out on Facebook so people can read about it, learn about it, watch a video about it. That's the next phase that we're going to go to. The concern being that you get so many people that you can't service them all, and then you have to turn, I'd hate to say what I'm saying, but the despair-ometer off because people will just be, oh my God, I can't. You're not available. You can't do it. So the timing's good for this call because we're just at the beginning of figuring that out. But could we drive
Right.
business? Yeah. Could we raise the rate? Yeah. But we need to make sure he's got the clinical piece down so he can service all the secondary stuff that people need. And maybe the light is the light bed one of them? Yes, maybe. But
George,
physiotherapy is a big
question.
yeah.
George, let me ask you a question.
Yeah.
Working with red light therapy for years now.
Mm-hmm.
You understand its power. It's not just John, I
Hey
advise you.
guys, really quick, sorry, I have to hop off in about 60 seconds. I had a 4 o'clock. I pushed it by 3 minutes. But yeah, Go ahead, Michael.
All
Sorry.
right, we understand that what you do and you do it well, and he's very, very, very good at
I
it.
believe
I was
you
just
do
giving
it
some
well.
words of wisdom to George as well, because I had multiple doctors in his shoes, nowhere near his expertise, but just in the same space. Hey, they were offering something, they wanted to scale, they had an issue. I don't think you should wait till your product is perfect to start really advertising and branding yourself, because so many people have superior products nowadays apart from your field. But if you haven't built up the marketing, there's definitely some time it's going to take. And organic is wonderful. It'll have better ROI than anything, except it's just not scalable, right? You cannot control how many people Google you. So, and it costs no dollars. So organic is great, but in terms of scaling, if you're going to have a product that's this superior, which I believe you 100%, you should really start branding yourself now, because the more you wait, the more delayed it's going to be, because there's always a time that you have to get. And the other issue too is, like you said, people haven't done this in like 50 years. So you're kind of the pioneer in this era. So that you're going to have to kind of re-educate the market on a problem that they have, but they just kind of,
That's right.
yeah, and that's going to take a lot of marketing and a lot of testing. So I wouldn't wait till the end to start seeing what message resonates to your target audience. And even if your audience is so micro niched, that's the beauty about paid ads. I can target by zip code, by age, by what they watch, by what they're watching on TV, by who they follow. I can target by net household income. So the money's not the problem at all. And that's the beauty about paid ads. I can target to the T versus organic. It's kind of like, well, if you have all the chiropractors marketing to this pain and you're doing the same thing, you're kind of being in the same pool as them. And that's something you definitely don't want to do.
I just have to see if I'm.
Yeah, absolutely. But yeah, let's.
Are you back?
Well, I
Dr.
appreciate
Renzulli,
your
I'll
insight,
call you
Dan.
shortly. Yeah, absolutely.
And I would like to continue the conversation.
Okay.
Okay.
Of course, I'll have Dr. Renzulli set it up.
Okay,
All
we'll
right.
go.
All right, speak to you. Pleasure meeting everyone.
Let me
All
know
right,
when
pleasure
you're
meeting
on and
you.
I'll jump
Be
on.
well, Daniel.
Okay. Okay, I'm just jumping off of Zoom. Give me 1 second. Give me 1 sec. Okay. Gang, I have got to go. That is my. They're
pleasure.
calling me before they can even download. And by the way, everything Daniel said, I totally agree with. They'll be coming out of the woodwork. That's going to be the issue, which is fine. All right, we'll talk. Thank you, guys.
We'll talk later, John. Thank you.
Bye-bye.
John. Nice to meet you. Take care.
Bye-bye. Sorry.
Well, that was an interesting conversation, Michael. Thank you for bringing on Daniel.
Let me ask you a question.
Yes.
I know your heart and you know the power of red light therapy. And I think you understand just how powerful our particular vet is. So I think you're congruent.
I wouldn't want any other product. That's not the issue.
Right, what I'm saying is I think you're completely congruent in delivering to your patients, which is I know you're all about. That's why I'm jazzed and I'm juiced, because I know what we have is so effective, because I feel it in my own life.
It's a matter, I think it's an issue on my end, a matter of infrastructure and how I'm going to scale. I think this is a topic that a year ago wasn't on my mind. It was more of like the setting up the brand and the
Let
marketing.
me ask you this.
Yes.
Osteo 360, I get it. Love it. Love it. Love it. Here we had this conversation before. Let me just summarize what we're talking about here. Your option is potentially hire another trainer, another physical therapist, another physician, whatever. That's a tremendous amount of money. That's big.
Exactly it. This is a multi-million-dollar enterprise.
It's $365 a visit. You can't afford to do that.
No, I cannot.
No, of course. So that's not happening.
Well, it's not happening.
Well, this is what my thought is, and you tell me if I'm wrong. I mean, am I missing something?
No, you're not missing anything. So
let me just summarize it, because I think I see things clearly.
Yeah.
You understand not only the science, but you understand.
Are we still recording? Can we not have this recorded?
Yeah, let's shut this off.
Okay.
Marla, I don't know who.